Hi, everyone, and welcome to Proven Best Practices Before, During, and After COVID. We are the Maddie's Shelter Medicine Program at the University of Florida and the Million Cat Challenge. We provide pro bono assessments all over the United States and are here this week in Broward providing an assessment for Broward County animal care and adoption. Our team this week is made up of only 2 people, although we do have a large mentorship program. Unfortunately, our students and interns couldn't make it this week, but our team here this week has done over 100 community and shelter assessments in 17 states, all over the United States, in communities that are larger than Broward, smaller than Broward, those with a higher poverty rate, lower poverty rate. And what we found is that everyone shares the same challenges, and the solutions are all very similar and universal, shelter to shelter and community to community. So the standards and recommendations that we will be talking about tonight can be found in the Association of Shelter Guidelines, Association of Shelter Veterinarians Guidelines for Standards of Care. And those are woven into the Best Practice Playbook for animal shelters. The Best Practice Playbook is available on Amazon, and you can learn all about the studies and backup and successful programs that I'm going to be talking about here this evening. The Million Cat Challenge, if you're not familiar, please join us at millioncatchallenge.org. And we had a goal of saving 1 million cats from euthanasia in the United States in 4 years, and we actually doubled that. So we saved 2 million cats in 4 years, and that's an amazing organization. There's no fee to join, so please come join us. If you haven't heard about fear-free certification for private practice veterinarians, please look into that as well at fearfree.com. And in November of 2019, Fear-Free created Fear-Free Shelter Training. That is free for shelters and nonprofits, and it really helps us hone in on the ways and types of programs that we can set up so we can reduce anxiety and fear and stress in pets, whether they're going to the veterinarian or they have to stay in the shelter. But I want to start with why you are all here. We are all here because we have one unified goal and one unified mission. We love animals. And when you think about it, it's not just that we want to save shelter animals. We actually would prefer if animals never went into a shelter, in whatever their circumstance, if they needed to get out of, they landed in a home where they were cared for and in a loving home. So remember that this is where we can all come together and work on behalf of dogs and cats. To start off with, I want to make sure that everybody knows that in the United States, in the last several decades, we have made tremendous progress. Back in the 90s, I've been in animal welfare for more than 30 years. Back in the 90s, there were over 20 million animals going into shelters, and most of them were being euthanized. Best Friends has done the most comprehensive data collection beginning in 2018. You can look on their website, bestfriends.org, under the dashboard and learn about all these numbers and see state by state and community how your community is doing. But we have made tremendous progress. We are down to 5.4 million animals entering shelters. That's dogs and cats entering shelters in the United States, and actually about 533,000 euthanized. That number, 625,000, includes owner-requested euthanasia. So overall, almost 80% of the animals that are entering shelters were saved in 2019. So the other thing that I want you to know about all the amazing things that happened out of the tragedy and the ongoing issues with the pandemic. There has been more good news than not, I think, in animal welfare. We were so panic-stricken in February and March, thinking that there would be this giant influx of animals into shelters, and actually the opposite happened. Adopt-a-Pet is a search engine, adoptapet.com. They normally see pre-COVID about 5 million visits a month. And during COVID, they were up to 12 million visits in 1 month because people wanted to adopt and foster. The number 3 breed search was pit bulls, and we'll come back to that. Many shelters were emptied through adoption, rescue, foster, and communities really stepped up. It was amazing to see. GreaterGood.org is an online fundraising organization, and they started an initiative called #StayHomeAndFoster. They recruited 82,000 people during COVID in the spring, but only 40,000 shelter pets were registered. So there were twice as many people who wanted to foster. Half of them had no pets or children in their homes, and half of them said they could foster a medium or large dog. And again, we were all panicked. Oh my gosh, all these animals are going to go in foster care, and then what are we going to do? But Maddie's Fund reported that between 75 and 80% of the fosters actually get adopted from their foster homes, or their fosters keep them, just like me. I'm a statistic. I fostered a dog during COVID and adopted her. The other thing we were afraid of during COVID is that nobody would give philanthropically. And so many organizations proved that wasn't the case. The Humane Society of Charlotte, these are just a few examples. They raised $150,000 in a couple of days. At the Million Cat Challenge, we raised, between in-kind donations and funding, actual money, almost $250,000 and counting. So we were able to buy thousands of portals for shelters all over the United States, including Broward. And we'll come back to portals. I have some pictures to show you and tell you why portals are so incredibly important for cats. But these numbers are staggering. And a lot of times shelters have told us that they exceeded their fundraising goal, just like Denver Dumb Friends did. Of course, we need to worry about what's going to happen in the next 6 to 12 months as the CARES Act expires, and we know a lot of people are facing eviction. So this is a big part of what we need to talk about here this evening. But again, I want us to appreciate in Broward, when I think back and looking at historical statistics, in the late 90s, over 20,000 animals were going into the county shelter, and 28,000 animals were going into the Humane Society of Broward County. So fast forward into the last fiscal year, and the Humane Society of Broward County took in about 8,000 animals, and the county shelter took in about little over 13,000 animals. So that's amazing. So there is progress being made, and for the first time in the last fiscal year, the county shelter exceeded a 90% live outcome for dogs, which is absolutely amazing. 80-ish% for cats. So we know that that happened because of so many of you and your organizations, rescues, transferring animals, volunteers helping, staff committed to saving animals. So this has been a team effort, and we know there's a very supportive, active, and caring animal welfare community here. We also know that you are in search for a new director and are helping to try to find the right person to lead the Broward County Animal Care and Adoption Center. We have to think about the traditional model first, because this was a very broken, it's a very archaic model that was created more than 100 years ago. The traditional system, it means for an open admission shelter, there's no barriers. Animals flood in, and then we panic to try to get them out. We put lots of self-imposed barriers to live outcome, or we just have too many animals to get everything done in one day that they need, and so they have a longer length of stay. The traditional system is not a functioning system for 2020, and we need to think about recreating this whole system. And what a perfect time now, as intake is in most shelters in the United States is actually much lower this spring and summer. The trends that Pet Health is showing is that we're still under intake compared to what we were last year. So the live outcome percentage is a part of the story, but our goal should be to keep animals out of the shelter, because any length of stay in the best shelter correlates with negative consequences. First of all, it's just stressful for animals to be in an unfamiliar setting or cage or run with people that they don't know. That's just stressful. It's stressful then when shelters become overcrowded. That's stressful for the staff, for volunteers, for rescue partners, for stakeholders. And we all know that overcrowding causes stress in the animals and more infectious disease transmission. It doesn't allow us to house them properly. Then rescues, adopters, fosters can't take as many animals because of infectious disease and the contagiousness of those diseases to perhaps other pets in their home. And then we're left with reactive and a waste of resources. So this is a very simple formula that we always have to be obsessed about and keeping in mind. The number of animals in the shelter must equal or be less than the numbers out of the shelter, and what matters in the middle, LOS, stands for length of stay. This formula needs to be balanced at all times, and that's how we provide a fear-free environment. So we on the national level, many of us from the University of Florida and a lot of other organizations are part of the Human Animal Support Services that we're calling HAS. And this is a coalition. There's 30 pilot shelters so far, but please check it out at humananimalsupportservices.org. It's all about these principles that we have been teaching and preaching. You'll read about it in the playbook. If you order the playbook and read that, is written for a very broad audience. So whether you're a volunteer or a shelter leader or a municipal leader, it would be really helpful for you. But please check out HAS, because it's really going to require all of us to think a little bit differently about shelters. And that's hard for us as people, because we are a product of our own microcosm. We all have had our own experiences in life. We've had different upbringings. Some of our families growing up had pets, some didn't have pets. What did we grow up in a rural community, an urban community? What were we taught about pets? What are our beliefs about how to care for pets? All of those things make up our personal microcosm, and that matters when we talk about working together or creating a divide because perhaps we don't believe the same things. But remember, we are all here because we care very deeply about animals, and we have to remember that our human brain automatically triggers and amplifies negatives. So if we had 100 amazing experiences today, but we had one really bad experience, that is the experience that we're gonna think about all night long, and it's gonna become bigger than the rest. We have to make sure we keep things in perspective, because our own fears can really be a barrier to life-saving. When our team first started assessments in 2013, we started in Waco, Texas, and I love using this example for you all because Waco, Texas has a really high poverty rate, 30%. In Broward County, the poverty rate is 14%. So imagine when we went to Waco and said, hey, you should try these strategies. And they said, oh, thanks, but we're just too poor. It's probably not going to work here. What I want to show you is how beautifully it worked here. So the green in this bar is the number of animals that left the shelter alive that year was in 10-11, fiscal year 10-11. And the blue is the number euthanized. For years before, they had never saved more than 30-36% of the animals. So we came in at the end of 2012 and helped them implement these strategies. No increase in resources immediately, And look at what happened. Intake dramatically decreased. Why? Targeted spay neuter was one thing, community cat programs. It was a whole host of things. Maybe we helped keep animals in homes, but the interesting thing about these graphs that we replicate in so many communities that we help is what you can see is the number of animals leaving alive stays relatively the same. We used to think, holy cow, we're gonna have to save 10,000 animals every year. But instead we have to think, wait a minute, how can we help people keep their pets, or what other options are there? How can we release this shelter intake bias that we suffer from? And remember that 90% sounds magical, but it is an arbitrary benchmark. We define true euthanasia and recommend true euthanasia for medical cases that are way beyond hope. Anybody's resources cannot save these pets, and large dangerous dogs who cannot be safely rehabilitated. Remember that using those definitions, there may be a shelter like there already are in the northeast part of the United States, the northwest part of the United States. Maybe their live outcome percentage is 75%, but they meet that criteria. So we have to keep that in mind too. 90% is a benchmark that we used and we still use we've used for a long time, because it was historically true that public shelters euthanized most of the animals, but that's no longer true. We're doing so much better than we did. And what we have to think about is what is in I think of these two silos. We have so many things that are not in our control. What about natural disasters? In Florida, we have to worry about hurricanes, cruelty or hoarding cases. Those things are not in our control. A pandemic, that certainly wasn't on our list last year, but that's an example of something that's not in our control. But look at what is in our control, what our local public policy is, what our intake and shelter policies are, what our population management, on and on and on. We have to look at all the things that are in our control, and that's how we get to systems change. We want to work smarter, not harder. And I also want to make a note about something that we've heard sporadically in the last several months. There have been rescue groups that said, well, that's all fine and good that shelters are decreasing their intake, but we're doing more work. And that is not the point here. We want to look at our communities, and I alluded to that in the beginning, how our communities have stepped up. So this is about all of us as stakeholders, rescue groups and shelters. We want to all work together to make sure we have these proactive things in place. If there's no other alternatives, okay, then they might have to come into a shelter or go to a rescue group. That will allow us to have a fear-free environment in a shelter that has finite space. And the key is that short length of stay. I cannot stress that enough. We have to have a plan the moment those animals come in. How are we going to get them to their live outcome opportunity as soon as possible? And that's how we get the result of true euthanasia only. People often think of resources only as money, but we have to think about strategically using all our resources. That resources is all of you, staff, volunteers, rescue partners, other shelter partners like the Humane Society, other transport partners, shelter space, other partnerships maybe we haven't even thought about yet. But instead of focusing on what we don't have, we need to make sure we're making the best of what we do have. And building the best foundation starts with public policy for sure, because that's the umbrella with which our shelters operate. When we do that, we minimize and oftentimes eliminate all these symptomatic issues that we all struggle with when the shelter is overcrowded, when there's a long length of stay. Those are symptomatic issues that we can resolve and prevent right from the beginning with the right foundation. Excuse me. So public policy is the framework that a shelter must operate on, and why this matters to nonprofits and 501c3 rescue groups and humane societies and SPCAs is because this can create long lengths of stay for no reason. We need to make sure that public policy is focused on public and animal safety and make sure that those ordinances are in line with best practice. We know that county and municipal shelters were created for public and animal safety, and our municipal leaders want to deliver a service, the public and animal safety service. They have to balance a budget, and they certainly want to eliminate waste. So that is all wrapped up in the goal of public and animal safety. And I assure you that best practices can marry all of our goals, whether you're a municipal leader, a rescue group, or a shelter director. Just a couple of examples of things we look at here in Florida at the state level. We don't have a mandated stray hold, which is good because that means that at the local level, the shelters can make an appropriate stray hold. For dogs, that's 3 days. We know that dogs are reunited within 72 hours for the most part from shelters. We also know that very few cats are reunited with their owners from shelters, so we recommend there is no stray hold, and I'm going to get to that a little bit later. No stray hold because those cats, we have a better solution. And then we don't want to penalize people. We want to incentivize them for reclaiming. I'm not talking about enforcement cases. Those are separate. Cruelty, neglect, those things are separate. But if somebody's dog got out accidentally, the lawn guy left the gate open, we want to make sure we're making it super easy for people to reclaim their pets and certainly not have any barriers to live outcome and life saving. It matters what our ACOs, which we call field officers, it matters what they do in the field. Are they trying to be punitive, or are they offering assistance and turning those high intake areas, like we see some shelters do, into low intake areas? And there's some great program examples that you can learn about, even just searching online or reading the playbook. So nationally, the return to owner rate for dogs is 22%, and for cats, it's less than 2%. At Broward County, at the Animal Care and Adoption Center, the shelter is right along those lines, right about those same percentages. But we have to think about it the opposite way. That means almost 80% of the time, I'm not reuniting pets with their families who are probably missing them. And almost 100% of the time, I'm not reuniting cats with their owners. So why would I ever have a stray hold on cats? It doesn't make any sense, because there's a better way. What we're learning now or thinking about now, and this is all woven in to social justice, animal welfare is right in there with the types of systems and organizations that need to reinvent themselves for nothing else, for the animals and in the interest of social justice, because what we have tended to do is take animals, dogs in particular, out of their, or cats, out of their neighborhoods when they were quote unquote stray and brought to a shelter, often a half an hour or an hour away from their neighborhoods. We're now finding, especially with apps like Nextdoor, which is amazing, that neighbors are the ones that are really finding their owners in their own neighborhoods. And there's lots of emerging data. Haas is going to be looking at this with all these pilot shelters. The data out of Austin shows that the neighbors return 50% of the dogs. So look what we're doing, 22% of the shelter. We need to be looking at asking people to foster in their own neighborhoods. And this happened to me just a couple weeks ago. There was a little stray dog running around, and I knew this dog was owned. I didn't know where he lived, but I walked around my neighborhood for an hour, and I ultimately found the owners. And that's what we want to encourage people to do, to reunite them in their own neighborhoods. And certainly if they do make it into the shelter, like I said, have an alternative to those fines and fees. So for example, if they're not sterilized, or if they don't have their rabies vaccination, or they're not microchipped, things like that. The next level is what's happening in our communities Are there partnerships with all the animal welfare organizations? Are there community programs where coalitions are working together and again, working smarter, not harder? Access to care was an important issue before, but again, moving forward into this next year, I don't know that it's ever going to be more important in our lifetimes than it will be in the next year. We really need to be seriously looking at how we can keep pets in their loving homes. A lot of people are going to be struggling. So just taking those animals into the shelter and then trying to find them another home will again just throw off that formula, clog the system, and it's not the best thing for the pets or the people. And I'm talking about when they're in loving homes, so that the shelter is reserved for those victims of cruelty and of neglect, the ones that we do need to take into the shelter. So we want to think about the shelter not just as a place where animals go to be left, but where people might get help, like a community animal resource center. And there's several amazing emerging models around access to care. National funders are really paying attention to this now. It's the hot topic. It's their #1 burden right now. Align Care is a pilot program out of the University of Tennessee, marrying human social services and including the pets in the services for the families. So we're hoping that that becomes part of the fabric of social services. Same with Open Door. There are test hospitals in Asheville, North Carolina, and Toledo, Ohio, proving that you can have a financially viable veterinary hospital and have access to care and help those people that perhaps could not go to a regular veterinarian. So these are all things that are happening now and have been in development, but there has never been a more important time in the next 6 to 12 months. Targeted spay neuter, Broward County, we should make a chart for Broward County because there's been a lot of spay neuter in this community, decreasing euthanasia numbers and decreasing intake, like I mentioned, but there's nothing that drives those numbers down more than targeted spay neuter. So this means I am going to help and subsidize the groups that are responsible for most of the shelter intake. So we know through Peter Marsh's research that low-income pet owners make up the majority of people that are surrendering to shelter or whose stray pets are in shelters. And when we do about 5 of those surgeries, subsidized surgeries per 1,000 people for low-income pet owners, it really quickly drives intake down. So this is a matter of making sure that people qualify for that program and not just giving free surgeries to people who could otherwise afford it. Then, of course, high intake areas, large breeds, which includes pit bulls. We don't like to call out pit bulls, but we know that it's on the forefront of people's minds. Most shelters now, especially in the South, have overrepresented numbers of pit bulls. But I will tell you some good news about that as well. Targeted TNR and a combination of other community cat programs also really can decrease shelter intake by 80 or 90% of cats. It's really amazing. But you can see here again, Waco, the same type of graph, targeted spay neuter goes up, intake and euthanasia go down. Huntsville, Alabama, their surgery graph was not as steep because they don't have high volume spay neuter programs. Those surgeries were done through private veterinarians, but they still saw the benefits of decreasing intake and euthanasia. It just happened over a longer period of time. Cats in the United States, Best Friends, again, that dashboard showed that in 2018 and again in 2019, twice as many shelter cats were euthanized compared to shelter dogs. And about 80%, and often more, in Broward, it's more than 80% of the cats entering the shelter are community cats. Often people trigger, when you say community cats, to feral cats in colonies, but in actuality, less than 5% of the cats outside are in colonies and are feral. So very few of those are at least in colonies. The great majority of them are people's friendly cats that just go in and out. Much higher risk. And this, when cats enter a shelter, that means there's overcapacity, and that means there's more URIs. That means our housing is compromised. But there is a solution, and it's been happening along with TNR here in Broward. It's called shelter, neuter, return, or return to field, which it's not really returning cats to any field. It's returning the cat if they did come in the shelter as a community cat, not to have a stray hold, and thankfully there's not one in Broward when they qualify for this program. They get sterilized, ear-tipped, and rabies vaccinated and put back where they were already cared for. And I'll tell you, when I learned about this program in 2008, I thought it was insane, and I didn't agree with it. But now I'm the preacher, because this is a typical community cat, 10 or 12 pounds, totally healthy, and there are at least 1 or 2 people taking care of this cat. More likely, 4 families think this is their cat, especially those friendlies that go in and out. We know that about half of American pet owners let their cats outside, and why we've trained the public to take an outside cat to a shelter, I don't know. Because, like I said, less than 2% are, sorry, I'm just trying to make sure this picture doesn't block your slide. Less than 2% are returned to their owner. So the answer is the superhighway. If they're not getting done through targeted TNR, they come into the shelter exclusively for the spay-neuter, ear-tip, rabies vaccination, and we have tons of data that shows less than 1% overall are too sick or injured or ill to put back. And we don't recommend testing for leukemia and FIV because the cats are transmitting it because they're intact. When you sterilize them, you have very, very low risk of transmitting leukemia and FIV. And the other reason is that you're putting them back in a neighborhood where there's surely other cats that are positive and doing just fine. We know now it's not the death sentence that it used to be when we first discovered those viruses. And there may be a small off-ramp for some of those cats that for whatever reason can't go back, but this will globally be appropriate for those cats. The other thing we need to be very serious about educating the public is not to kidnap the kittens. Those mama cats out there that are nursing their kittens have to get something to eat. So while they're eating, those kittens are going to cry and make a fuss, and people often think that they're abandoned. So they take them to a shelter where they are still nursing, and most shelters don't have the capacity to bottle feed all these babies. So they are the highest risk for euthanasia. So we want to teach people to monitor the situation, what to look for, to make sure the kittens are still thriving and healthy, and only take them to, only intervene if they absolutely have to. Lots of great information on so many of the national websites, kittenlady.org. If you don't know about that website, please visit it. Hannah Shaw has amazing videos, training webinars, really, really great information. The superhighway for those little kittens, again, small off-ramp if they're feral, because actually taming feral kittens is going to take so long, and you might never tame them, and you just took up a foster home trying, where, okay, those kittens may go back out with their mom and dads, but kittens, instead of coming into a shelter, getting them adopted right from the foster home, instead of coming into the shelter where they're at risk and vulnerable to shelter diseases that are unavoidable in shelters. But this program, like I said, it is done in Broward. We're going to make some more recommendations on how to make it bigger and better and decrease numbers of overall cats, but it really is beneficial for everybody. It decreases the number of community cats outside, especially those interacting negatively with people, decrease impact on wildlife. As I keep saying, decreased intake of shelter cats, and dramatically, also we've seen shelters that decrease their enforcement complaints around cats by 90%. That's amazing. And then what you're left with is more resources, more time for staff and volunteers to help dogs, whether that's safety net or training and enrichment when they do come in the shelter. People often ask us who pays for it and who does all the work, and the answer is that's where the coalition comes in. So there's not one answer. Sometimes the public shelter does everything and the ACOs return the cats home. Sometimes the nonprofit does it all. The money is raised sometimes with municipal money and a combination of municipal and private funding. So there's not one particular answer. There's all kinds of answers for that question. Back to Jacksonville, where we have the most data because this is how our assessment program model actually started. But as you can see, remember the chart, green is the number of cats that left alive, and blue is the euthanasia. So look what happened. The very first year they did this program, the live outcome jumped up, and over time, because those cats were not reproducing and reproducing and reproducing, people didn't have any more cats to bring in. So the intake dramatically decreased. And these are phenomenal decreases. Way back when, 20 years ago, if we saw a decrease in intake that was 2 or 3%, we would celebrate. These are astronomical. I'm so happy now that we have this information and programs. Nashville, again, look at the green, increased live outcome as intake and euthanasia decrease because of these community cat programs and amazing public-private partnerships in Nashville. In Greenville, South Carolina, the very first year was here at the end of 2015, and the very first year, 2,000 less euthanasias, and that was budget neutral because the cost of care to take all those animals in the shelter and to euthanize them, even because they saved about as many, cost the same amount of money instead to take them across their parking lot to their spay or neuter clinic. When we got to Greenville, they were packed with cats in small cages. This is an example of a portal now in Greenville, because when I was there in 2019, 4 years later, this was the only feline in adoptions, and he had a portal. So he had his litter box on the other side, and he has his food and water and play stuff on this side. We help communities develop these brochures. Sometimes it's door hangers, and the ACOs have, and the field officers have those available, just to explain to the public what these ear-tip cats mean, because initially when you say putting the cat right back, like, but I don't want the cat, perhaps, a lot of times people just think they're lost, but this is a way to say, hey, this is going to get rid of your problems because you're being annoyed by all these intact behaviors. So again, I encourage you to join us, millioncatchallenge.org. We did a webinar called Creating a Roadmap for #AllTheCats. It's called the Cat Superhighway. It is chock full. If you are interested in the studies, the research, the data, endless statistics, please watch that webinar. You'll find it under millioncatchallenge.org, resources and webinars. So now when we think about all those things that we can do proactively to keep animals from piling in the shelter, the managed admission system means just that. I am only going to take in animals to the shelter that have no other options, or perhaps they are an enforcement case, need emergency medical care, or whatever the situation is as a stray. And that's called managed admission. And we can actually help more people and pets that way versus taking them into a shelter. And Maddie's is looking at actually what those dollars look like. At Jacksonville Humane Society, they tell us, boy, it's always cheaper to help somebody keep their pet than to take them into the shelter. So if they're in a good home already, keep them in that good home. That's what I mean by productively decreasing shelter intake. And again, it's not to insinuate that we want to overwhelm rescues. We want rescues to get the support that they need as well with respect to services. So this means managed admission. Let's flip that funnel on its head and let's look at all these other alternatives that can happen outside of the shelter system and only take in those that need to come in the shelter and then remove barriers to get them out, and you end up with a short length of stay. The ASPCA did a study that was very humbling to me in 2015, and they showed that about 80% of the people polled that surrendered did not want to. They just did not have access to the resources they needed, and they surrendered to a shelter. And that's just heartbreaking. So now we should be saying, hey, what do you need to keep your pet? How can we help you place your pet? That access to care piece, so important. When we started working with the Broward Sheriff's Office in Melbourne, Florida, we said, hey, you should try this program. And if you help 30% of the owner surrenders, that's going to be amazing. But look at what they did out of the gate for the first year and the last 4 years since this program started. 80% of those people were helped without ever coming into the shelter. The Sheriff Ivy has an amazing pet posse and they raise money for this. But that first year, it was all budget neutral. In Jacksonville, they started a Good Samaritan program. They got to that 90% live outcome and they said to people, oh my gosh, we don't want to euthanize for space. Is there any way you could foster these babies and help us try to find them homes, or foster this stray pet and try to help find their owner? And they went in 1 year from 456 fosters to over 3,000, almost 4,000 fosters in 1 year. But Jacksonville, the secret is, has an amazing well-oiled live outcome machine. So the length of stay, if they do come back to the shelter, is very short. So this is not to insinuate they go in foster care and get stuck. This means we have to get them into their permanent homes as quickly as possible. And there's new organizations like Home to Home that can help with this. Adopt a Pet Rehome is another website you can look at, but Home to Home bypasses the shelter. So it links somebody who wants to adopt with somebody who needs to place their pet. And this website can be integrated into your organization's Facebook page and website, so it's branded for every shelter. So really encourage everybody to look at those virtual opportunities that we were so catapulted into looking at during COVID, right? With all the virtual tools that we have, it's been incredible. So we need to always be remembering this formula. It always needs to balance. And just because we have room or cages open in the shelter doesn't mean we should fill them, because it's really scary for a pet to come into a shelter. It's best if they stay in an actual home. We also need to remember that formula, because we lose our ability to provide a fear-free environment when we don't. And that means that once the pet comes into the shelter, C for C means capacity for care. And that means that I have the resources to care for the animals in my care and provide them with a fear-free environment. That means from the moment they enter the shelter, there's a plan of action to get them out. 14 days is considered a long length of stay. After that, we need to be making sure we're doing extra advocacy. We need to make sure there's streamlined communication, especially in today's day and age and with COVID. There's so many people that want to help. We need to capitalize on that technology and have other opportunities for communication. For example, a lot of telemedicine apps have been really highlighted recently. Pet Pro by BI is one. Best Friends has a vet access where they're providing it for free for shelters this year, where you can actually get medical advice if you're a foster or adopter from a veterinarian. We want to make sure we're eliminating any self-imposed barriers to live outcome, and that is what allows us to provide humane housing and enrichment in the shelter. But most shelters that we know couldn't operate and deliver the best animal care without a dedicated volunteer program. And volunteers are so crucial, not just to supplement the care of the animals, but to really help the staff and take a load off the staff. There certainly must be standard operating procedures for all staff and volunteers. Everybody needs to be trained appropriately. Fear-free training is a great place to start. The online videos and that online process is really helpful. But like as with every volunteer program, whether it's a rescue partnership or a volunteer in the shelter, there needs to be a mutual respect and communication. So again, looking at all these ways that we can make sure that we have the shortest length of stay, we want to make sure that we're highlighting the pets certainly on our website. When people are allowed back in the shelters, that all the pets that could potentially leave, whether it's foster or adoption, even if they do have medical issues, let the adopters decide what they can or can't handle with your assistance. But it should be first come, first serve. And we even see lots of great virtual adoptions happening. And like I said, lots of great connections being made with all these virtual programs. But non-negotiable is appropriate housing, appropriate sanitation. We know that pets will select a soft place to stay if they're given an option. They need exercise just like people. They need something to do. They need attention and love. And so typically the shelter staff, there's not enough people to give every single animal individualized care, and that's why the volunteer corps is so important. But just like for dogs, non-negotiable double compartment housing, and this is what I alluded to before, these are the portals. So at Broward, they do have some free roam rooms, but a lot of the cages are stainless steel cages, and these portals are now on site thanks to the Million Cat Challenge and a local funder that paid for the portals. But you can close this if you need to just spot clean while the cat is in the shelter, and then you open it and the cat can go back and forth. They like to play in it, but it gives them this space that they need to stay healthy. So our live outcome pathways, again, return to owner, targeted TNR, shelter neuter return for those community cats, foster to adoption so they don't come back to the shelter. Either the foster home adopts them or they get adopted through the foster home, a straight out adoption, a rescue partner, or a transfer to another shelter. All of that leads to what happens with adoption and how are those decisions being made. One really piece of exciting news that I saw, we visit a lot of shelters, we work with a lot of shelters nationally, and in most shelters, pit bulls are overrepresented. In Jacksonville, for example, they've been over 95% live outcome for many years now, and they have only bully breeds. Greater Good this spring reported that pit bulls were the third in the searched breed when people were searching for breeds to adopt. So shelters often and rescues often say, oh, we only have pit bulls, so that's why they get stuck in the shelter. No, we have to be the spokesperson. We have to be their advocates. So there are not a shortage of adopters. Best Friends did a study a couple of years ago that showed that 70% of the people who went to a breeder or pet store actually had already gone to a rescue group or shelter, and it was too cumbersome, difficult, invasive, or they were denied, so they went to a breeder or pet store. There is no shortage of adoptions, and we know that now, and COVID taught us nothing else. It taught us that. We sometimes have the best of intentions, but again, that fear of, oh, I have this particular bias, I can't trust my community, we don't have a lot of good adopters here, nobody's a good enough pet owner, we have to transport. Those things are not true. Those are our own self-imposed biases, all part of the topic of social justice. This is about trusting our community and knowing that more people are good. We also have to respect our own microcosm and give ourselves grace, because I know what's on your Facebook feeds is a lot of neglect, a lot of cruelty, a lot of those cases, but that's not the norm. And what you'll read about, please get Adopters Welcome. It is on animalsheltering.org from the Humane Society of the United States. You can buy it for $15 or just download it or read it for free online. But one of the most beautiful set of numbers that I've ever read says there are 144 million pets with families in the United States, and now we know 5.3 million going into shelters. A very small percentage of those are victims of cruelty, neglect, and true abandonment. And so who is coming to your adoption venues, your shelters, your rescue groups? Part of that 144 million. You can be sure most people are good. So it's important to trust and engage our communities and counsel them, not just before. We want to make the right match, and we want to be there to help them post-adoption. We also want to make it an easy, streamlined process for them. Shout out to all the rescues and transfer partners. I know in this area, a very passionate group of people. We love rescue partners. We want to make sure that there's protocols, SOPs for everybody that are mutually beneficial. There's clear guidelines, but for dogs especially, this is an amazing life-saving network. We'd love to see more cat rescues because a lot of shelters are still struggling with cats, and it's no different in Broward. There's a lot of cats everywhere. So I want to thank you so much for listening this evening. You can follow us on Facebook at Maddie's Shelter Medicine Program at the University of Florida. And I will end with my previous foster dog. I am not a foster failure. I am an adoption success. And this is her adoption party picture. So thanks again. Have a beautiful evening, and we appreciate you joining us.